Hi, I'm Dr. Patty Barch. I'm the founder of Naturally Unbridled Wellness in Onalaska, Wisconsin, and I'm a traditional naturopath. The information presented here is for educational purposes only and is not intended to diagnose, treat, cure, or prescribe for any disease or condition. Please consult your preferred healthcare provider, elected official, or 22-year-old social media fact checker when making wellness choices. Let's just go with the whole disclaimer of nothing I say here is true. It's all for entertainment. Okay? So, that being said, I got some stuff to share with you. So, I'm going to talk to you a little bit about what I and some of my colleagues are seeing and just give you an option to kind of look into things for yourself. So first of all, I'm going to be talking about breast health and thermography and a connection, potentially a connection to the experimental injections that a lot of people have been receiving over the past year plus. So, this first came to my attention last fall. A client of mine reported to me that her sister had a 3D breast MRI that was clear and totally clear, good to go, 3D breast imaging. And that was in spring of 2021. And she got her injections, and by August, she had a palpable lump in her breast and had ended up having further testing and a biopsy and was diagnosed with stage 2 breast carcinoma. So she had gone from perfectly crystal clear, clean, healthy breast to stage 2 cancer in just a matter of months. And the interesting thing was that she had that cancer develop on the breast that was on the same side that she received that experimental injection or those injections. So that was interesting and disconcerting. Prior to that, we've been doing breast thermography here for years. We used to have an independent contractor come in and do it, and now we do it ourselves. And within just a few months of those injections coming out, we received a notification from the interpretation company that we submit the images to. And that company said, hey, you need to wait 4 weeks after someone gets an injection because it's showing up as massive inflammation in the breast because of the lymphatic tissue that goes from the arm into the breast. So that was kind of a big, oh boy, moment. Like, it's kind of scary because you're getting massive amounts of inflammation in the breast after an injection in the arm. So, that was within just a few months that they had received so many scan images with massive breast inflammation that they came up with this policy that people need to wait 4 weeks before having breast thermography. Fast forward to last weekend, I was on the phone or just messaging with a good friend of mine who's a practitioner in New York. And now New York has a very high injection rate. Like here in Wisconsin, in my inner circle, within my clientele, I'm probably about 50%, maybe only 40%. I'm asking people, I'm just kind of tracking it, but not taking data down. Anyway, New York has a much higher injection rate. So she said that she's had 3 clients in the past several months who all received a breast cancer diagnosis since getting those injections. And it's to the point that the primary care physician, the radiologist, and the oncologist all asked the clients, which arm did you get your shots in? And there seems to be a correlation. So when I was talking to her, I was like, oh boy, so we need to just give people the opportunity to get this checked to see if they're beyond 4 weeks of getting that injection, do they still have inflammation in the breast, and could there be pathology developing? So breast thermography is a non-invasive, non-radiation method of evaluating pain and pathology in the body. So anytime there's an imbalance in the body, the first thing to know about it is the nervous system. And the nervous system is going to tell the circulatory system to go pay special attention to that area and see what needs to be done. Do we need to bring in white blood cells to fight an infection? Do we need to bring in more nutrients and oxygen to heal a wound? What needs to happen? And the nervous system is the first thing to respond to that. So what will happen is, in an area where there is pathology happening in the body, very often you will see increased temperature. So we use a medical grade infrared camera to take images of any part of the body, but in this case we're talking about breasts, and we take a series of 6 images. I'll show you some examples in a moment. And we submit those pictures to thermologists. Thermologists are medical doctors who are trained in interpreting these scans. And the medical doctors, they use a visual analysis and then special software for a pixel by pixel analysis to determine if there are patterns in the tissue that could be in alignment with things like cancer, fibrocystic breast, that sort of thing. You cannot do breast thermography if you are breastfeeding or if you are pregnant. You can do breast thermography if you have implants, okay? Those are the most common questions that we get. Now, breast thermography is no radiation, no crushing, no contact, and no peeking. Anytime you're undressed, you're actually behind us, and we use our camera that we set off to the side, and the camera is focused on you, and you're sitting on a little rotating stool. The camera shows us a black and white image, grainy, kind of like the old TV kind of grainy black and white images, and then a Technicolor image. Now the Technicolor image, so there's no skin images, it's not like anything dirty. So the images might look like this. So the top image is, healthy breasts that are bluish, so they're pretty cold. We see that with, dense breast tissue, and we see that with breast implants. But then you can see, obviously, the bottom breast has a lot of inflammation in it, but that's not cancerous at this point. It's fibrocystic, which is a different thing. And then you can see this series of images actually tracked the development of cancer, that it took a full year of these thermography images showing there was a problem before that actually showed up on mammogram. And then you can see these are some other images that just to show examples. So typically when we do breast thermography here, it's $150. We take a series of 6 images: front, quarter turn, side turn, and the back. We submit those images to the thermologist. It's normally $150. We are running a promotion through the end of April 2022 where you can do breast thermography for $99. Now, if you've ever done breast thermography before and you're in our system, you can call that your annual and then just re-up next year if you like. If you're due or not due, you can do it. And obviously, we are not going to discriminate against people who did not get the vaccine. Discrimination is what the other people do. Anyone is welcome to do breast thermography. And in fact, even men can do it, because if you're a man that has a lot of breast cancer in the family and you did receive an injection, as long as you don't have a really hairy chest, you can do the breast thermography as well. Now, the way this works is we take those 6 images, we submit them, we get a report back from the medical doctors, we send you the report, and if there's anything that needs to be discussed, we'll give you a call and set up a 15-minute phone call. If everything looks good, we'll probably just leave it at that, but you can always email us to ask any questions. Ideally, what you would do when starting breast thermography, if you've never done it before, is 13 weeks from now, you would do a second series of images so that we could compare those two and make sure that they're stable. So this is called establishing a baseline. And typically that second scan is $125, but if you prepay for it during our promotional period, it's also $99. So anyone has is qualified to take advantage of this promotion. If you have any questions, we're more than happy to help. You can also go to naturallyunbridled.com/thermography for more information on thermography and our services. So that's about it. Thanks, and have a healthy day.